It's that time of year again. Time to start looking at those Part D plans for 2025. So let's get to it. Part D plans have been all over the news because of those huge changes coming in 2025 and 2026 as well. Now, I'm not going to go into the full details in today's video because that is a full-length video in and of itself. But if you do want to check out that full-length video, I'll make sure to link it at the end of today's video. But a brief summary. First, the donut hole. It's going away, thank goodness. So in the past, yes, you would move from initial coverage into the donut hole, but now there is no more donut hole. You'll move directly from the initial coverage phase into catastrophic coverage. And that's where another big change comes in. So it used to be that you would have that 5% coinsurance. That coinsurance has been eliminated entirely, which really makes catastrophic coverage more like an out-of-pocket max that you might have with other forms of health insurance. And then of course, that $8,000 threshold to move into catastrophic coverage has been lowered all the way down to $2,000. So that is a major change. There are also some steps being taken to stabilize premiums on a yearly basis and new negotiated drug prices, but those are yet to come. A brief pause here to please remind you to like and subscribe to stay up to date. Now, of course, if you have questions, feedback, comments, you can reach us in the comments below. And if you need assistance in any way or would just like to speak with us on the phone, you can reach us at the number on the screen. We are licensed nationwide and there's absolutely no charge for our services. All right, let's get back to it. All right, we are on Medicare.gov and we're going to look at Part D plans. And you can see that plans are finally available for preview for 2025. We are going to put in a Florida zip code. We're just looking at Part D plans, so let's click on that. Now, ordinarily, of course, if you got help with your Medicare health or drug costs with any of these programs, you would click on that. For today, we're putting I don't get any help from any of these programs, but please do look into these. You may be eligible for something like extra help based on your income. And if you are eligible for Medicaid and Medicare, then you can look into D-SNPs. We're going to put, I don't get help from any of these programs. Do you want to see your drug costs? Yes. I am going to put in a whole bunch of prescription drugs. I don't even know if these prescription drugs can be taken together. I just want to see if we can get us up to that $2,000 catastrophic coverage threshold, which is really more like an out-of-pocket maximum at this point. All right, let's do that one. Let's add another drug. Let's do a couple more. Let's try this one. Honestly, I could probably just take their suggestions for the pop-ups here. Add another drug. Let's try Zoloft. Sure. Add that. Let's add another one. Let's try whoops, we definitely don't want to do that. Which one do we add twice? Oh no, we don't need to do that. Okay, how many do we have so far? Albuterol, 1, 2, 3, 4, 5. All right, we'll add one more. You know what, like I said, I could really just start typing with these drug names. Quantity, yeah, 1, add to my drug list. All right, done adding drugs. All right, it's going to ask us to select pharmacies. I always like to select at least the mail order pharmacy so that you can compare. Oftentimes the mail order pharmacy will be less expensive, although I have seen some instances where it's not, which is unusual. Even if it is less expensive, sometimes it's so comparable that it might still be more convenient to go to a brick and mortar, but good to have it there for comparison's sake. So we'll add Publix, Walgreens, CVS, and Walmart. Done. Now it's going to show us all of the plans available, and it's currently filtering by lowest drug plus premium cost. So our first plan here actually has no monthly premium, and you'll notice that with the WellCare Value Script plans. That does have the deductible, which in 2025, the deductible is $590, can be less, and of course we'll see some of those in just a minute. And then this is the estimate for your yearly costs. And look at that, the mail order pharmacy is actually more expensive. So we're going to start comparing some of these plans in just a minute, but what you can do is just click over here, view drugs and their costs, because really that's sort of the most important thing. All right, so let's see. All of these are generics, so they're going to be much less expensive. Let's see. And then here are, so that's why some of our expenses are a bit high, because albuterol is not covered at all. So let's see. A good chunk of our yearly costs are just the albuterol. Let's see. But at least it does give you an estimate of what the costs would be at those various pharmacies, even though it's not covered. And now you can see what the costs are for these prescriptions at the various pharmacies. This is very helpful if you're really trying to be cost conscious, because if you have multiple prescriptions, let's say one of the pharmacies, 4 out of 5 prescriptions are the least expensive there, but actually one of your prescriptions is less expensive at another pharmacy, well, then you could go to another pharmacy to fill that prescription if it is a considerable difference. Anyway, so this is how it breaks down what your estimate of your yearly cost would be. So in this instance, we actually didn't even meet the catastrophic coverage threshold, because this unfortunately wouldn't count towards that threshold because it is not covered. Catastrophic coverage is only taking into consideration the medications that are actually covered. Here you'll also see that it is mentioning that Medicare prescription payment plan. So in the past, of course, when you would go to fill a prescription, you had to pay for the prescription at that time. Now you're able to sort of spread it out over the month, which can definitely be helpful, especially if you have to take a medication that's more expensive like this one. Now it is breaking it down, the total drug and premium cost for the year, and when you would meet your deductible, it's estimating it. So yeah, you would meet your deductible later at the Publix pharmacy because those copays are less. Well, at least this copay is much less. And here's your estimated monthly cost as well. Good if you're budgeting for the year, or especially if you're somebody that does need to spread out those costs over the course of the month. The drug prices shown may vary based on the plan and the pharmacy you've selected. Contact the plan if you have specific questions about drug costs. For 2025, you won't pay more than $2,000 out of pocket for covered Part D costs. And that really is the shame here, is that first medication isn't covered. More drug coverage. Now, this is helpful to know because, you don't have a crystal ball. You could only put in the information that you have available to you at this time. However, if you do need to take more medications than what you planned when you're enrolling, it's good to know what those costs would be on your plan. So preferred generic, no cost. Generic, $5. Preferred brand, 25% coinsurance. Non-preferred, that's when we start to get expensive, 38% coinsurance, and specialty tier, 25%. Of course, if you're in the catastrophic coverage phase, those huge changes in 2025, no cost whatsoever, as long as it is covered. And then here's the breakdown of those medications. So this medication is tier 1, which means no copay. This medication is tier 1, which means no copay. Then this medication is tier 2, so we have a $5 copay. This medication is tier 3, 25%. And then this is an expensive, it's an expensive coinsurance, not necessarily an expensive medication, 38%. So let's take a look up here. I want to see how that breaks down. Here you can see, so I clicked on Publix because that seems to be our least expensive option. So we're going to ignore this one because it's just not covered. So each and every time before the deductible, this medication is $5. This medication is $0. This is the one that had a 38% coinsurance. So your cost is $62.65 before the deductible because that's a higher tier medication. Then after the deductible, it's $23.81. This is one of the trickier things to understand about Part D plans. So not only are the copays or coinsurance as determined by the tiers different in the different plans, but the actual tiers themselves can be different from plan to plan. Some may have 5 tiers, some may have 6 tiers, some may have 3 tiers, etc. And very often, those lower tier medications will be covered prior to meeting the deductible, but that's not always the case, which is what we're going to see momentarily. So these medications are covered prior meeting the deductible. That's a tier 1 and a tier 2 medication. So you'll notice that their costs are not the same. This medication was it was a tier 3, tier 4, non-preferred drug. Okay, so this was the tier 4 medication. So before you meet the deductible, you have to pay the full cost. After you've met the deductible, you pay that 38% coinsurance. This medication, I put it in accidentally, but I'm glad I did. It's actually an insulin, so it's capped at a $35 per 30-day supply. So even though it's considered a tier 3 medication, it is covered prior to meeting the deductible, although others might not be. Then there is this medication, which must be a tier 1 because it's no cost. And that breaks down your monthly cost with the medication that is also not covered at all. I hope that makes sense. I know it's a little confusing. Okay, so let's go back and compare this to another plan. Okay, so if you wanted to, you can actually add to compare multiple different plans. What I would like to do, though, is I'm going to pick one of these different plans. Let's look at this one. I want to look at this plan, view drugs and their costs, and basically do the same thing that we just looked at, but with this plan. Let's scroll down. Okay, so the albuterol actually is covered by this plan, but this isn't, so that's why it's so expensive. Let's see. So we are again surpassing our out-of-pocket maximum because this is not covered, so it doesn't count towards our catastrophic coverage threshold. Let's scroll down and see what the costs of the different tiers are. Okay, so for this one, there is a copay for preferred generic, which is the first tier of this one. Generic is a $10, preferred brand 19%, non-preferred 31%, specialty tier 25%. So if you're somebody that was to take what would be considered a preferred brand on this plan, and another plan also considered it, that other plan that we were just looking at considered a preferred brand, then it would actually be less expensive on this plan. So let's see, we've got, according to this plan, we've got tier 3, tier 1, tier 3, not covered, tier 1. So you can see how very different they are already. We had tier 4 on the other plan. This one wasn't covered. We had more tier 1s. We had a couple of tier 2s. That and the copays and coinsurance themselves are also different. So let's scroll up. I want to see which one was our least expensive option here as well. Okay, so Walgreens is our least expensive option on this one. So let's take a look. Okay, so these ones are not covered. They don't consider anything basically covered even prior to meeting the deductible. That's kind of interesting and maybe a little unusual. I'm used to plans providing some type of coverage before you've met the deductible. So that is a little interesting. So it's not like these are very expensive medications. This medication is only $6.57 prior to meeting the deductible, which drops down to $5 once you've met the deductible. This medication is actually less expensive than the copay. The copay, right, remember, for a tier 1 medication is $5. So it's actually less expensive. It's $1.98, and it's not going to go up once you've met the deductible. That would be ridiculous. So it just stays at $1.98. So basically, nothing on this plan is covered prior to meeting the deductible. For the medications that we've put in, let's see if there's any significant changes. I mean, this one, the albuterol goes from $4.42 to 84 cents. And of course, the hydrocodone goes from $42 to $8. That's why it's a little difficult to pick Part D plans. It's not so difficult when you know what all of your medications are. What is difficult is that you don't know what the future is going to bring. So the plans are really all different. It's hard to say, what is the best plan, because this plan might certainly be better if you are somebody who takes more of what this plan would consider these tier 3, 19% coinsurance type of medications. And that's why it's so important to provide your broker with a full and accurate list of all the medications you take. All right, we'll also take a look at this one. So again, the albuterol isn't covered. All right, so this one is more similar to the first plan that we looked at, right? $0, $5, 22% coinsurance, 35% coinsurance, 25% coinsurance. Let's see. So yeah, this one's actually very similar to that first plan that we looked at, right? Not covered, tier 4, tier 1, tier 4, tier 3, and tier 1. So let's see how that breaks down, which is our least expensive here. Probably Publix. Yep, Publix for this one.
So our albuterol, not covered with this one. These medications, this one, and this one, and this one, are not covered prior to meeting the deductible. Which tiers are those? But I don't know if tier 2 are covered prior to meeting the deductible because we don't have any tier 2 medications. But we know that tier 1 are covered prior to meeting the deductible, unlike the plan that we just looked at. So this is more similar to the first plan. And the tier 3 medications are not covered until after you've met the deductible. So tier 3 and tier 4, you're going to pay the actual retail cost. And then after you've met your deductible, it drops down pretty significantly. Oh no, I'm sorry. This one, because the insulin is capped, right? Silly me. Okay. Something else to take into consideration. Now, all of the pharmacies that we've put in for the plans that we've looked at have always been in network, but they're not always in network. And if that's the case, you definitely want to go to the pharmacies that are in network as long as you are physically able. If not, you might want to rely more on a mail order pharmacy. You'll also see that sometimes there's a check mark that says preferred. So let's take a look at those costs and how it affects it. You'll notice that in general, the ones that have the preferred check mark are going to be less expensive. So although Walmart is in network, these other pharmacies are preferred. And you can see when comparing the costs that it is more expensive than the others. It's not necessarily a huge difference because it is still a network. It's not preferred, which means the other ones will usually be less expensive.
If you do need prescription drug coverage, and of course we highly recommend that you do enroll in some type of prescription drug plan because there is that Part D late enrollment penalty that you may be beholden to otherwise. Remember, if you go for a period of more than 63 days without creditable coverage, then you may be subject to the Part D late enrollment penalty. And since there are so many Part D plans that are so very inexpensive, sometimes with no monthly premium, there's really no reason not to sign up. But anyway, when you do go to sign up for Part D, you can do so during either your initial individual enrollment period, which is the 3 months before you turn 65, the month of your 65th birthday, and the 3 months thereafter, or during the AEP, which is every year from October 15th to December 7th. Now, during this time, you can use Medicare.gov, which is the website we were just looking at. You can call the carrier directly and work with an agent. But remember, if you do go this route, the agent is only able to present you with their carrier's plans, so you won't be able to preview plans offered by other insurance companies, or you can work with a broker. Now, a broker works for you as opposed to the carrier, and that means that they can preview with you a variety of different plans offered by a variety of different carriers, and many do so at no additional charge. Now, of course, at iHealthBrokers, we are licensed health insurance brokers. So if you have questions, if you need help, you can reach us in the comments below or at the number on the screen. Now, if you do want to learn more about Part D plans or even Medicare Advantage plans, I'd highly recommend you check out this playlist over here. And if you want to go more in depth about those big changes coming to Part D in 2025 and beyond, make sure to check out this video as well. As always, please make sure to like and subscribe, and we'll see you next time.